Hello, I'm Victoria Emerton and welcome to Behind the Design, brought to you by Design in Mental Health, the leading in-person event connecting professionals from around the world who design, create, manage and deliver care in the built environment for mental health care. Design in Mental Health takes place in the UK each June and features a comprehensive programme of presentations, panels and workshops, a free-to-attend exhibition of specialist products and services, and the prestigious Design in Mental Health Awards. Information on event dates, programme details and how to book your event pass are on the event website designinmentalhealth.com. Today, I'm delighted to be joined by Raf Hamaizia, Expert by Experience Lead at Cygnet Health Care. Raf, thank you very much for your time and welcome to Behind the Design.
Thank you so much for having me today, Victoria.
So you're going to be presenting at Design in Mental Health in Manchester in June. We're very excited about that. And we're going to talk a little bit about what you'll be covering. So what was the inspiration behind starting the social hubs?
So the social hubs are really something that came from a historic lack of engagement that we've had in the space, really. Mental health, learning disabilities, when it comes to hospital environments, inpatient environments, historically they've been quite restrictive in nature, and we've been very much focused on risk, on safety, whereas there's something that's been lost in that, in terms of that, in the importance of engagement, the importance of meaningful activity, not only during the day, but particularly on the evenings and weekends. And it's something that we've kind of seen through feedback for quite a long time. And from my professional experience of not only being a former patient myself, but also having been able to travel around the country with the Care Quality Commission doing inspections. So when really sitting down with service users, with staff, and saying, well, what can we do? What can we do different? And that's where that discussion around the built environment came into it, and said, you know, what if there was a space that could be individually risk assessed, a space that different people from different wards can come and interact together, a space that can be open in the evenings, open on the weekends, a space where we can have access to things that we might not usually have access to on the wards. And when you muddle all of that together and you let service users and staff create a wish list of their own making, you end up with almost like a half arcade / disco / recording studio with lots of sensory lights and TVs and games and a really fun room. But what actually is the heart of that is that engagement and that connectedness between people with lived experience, i.e. people using services, and the staff.
Yes, it's so important to listen, isn't it? And to talk to people using facilities. So what impact have they had on the ground? What sort of tangible results can you see from your social hubs?
So the social hubs have helped satisfaction significantly. They've helped reduce incidents. So, for example, acts of violence and aggression. We've seen a reduction in restraints in many areas. We've seen a reduction in complaints in some areas. So the benefits are multifaceted, but one of the main benefits is really being having something to do. A lot of people, particularly if you don't have Section 17 leave, so that's the ability to go into the community, you're kind of maybe stuck with the more traditional things that are available within inpatient services. And there's lots of activities, and we've got amazing occupational therapists, but people tend to have a working shift, a working pattern, and in the evenings and weekends, I think that's where we've seen a lot of challenges. And in the places where we've established social hubs, for a lot of them, those issues have been eradicated. Service users are reporting that they're able to create new friends and peer support through having a space to interact with service users from other wards. And it's really important that we understand that, Victoria, because from the perception of a service user, when you're stuck on a mental health ward, your world becomes that ward. And you have people who may be upstairs on another ward, but you never get to see that ward. You never really get to even see the people on that ward unless you happen to bump into them in an occasional activity or just outside of the hospital if you happen to have Section 17 leave. So the social hubs have created a dynamic now where people are connecting to each other from different wards, creating new friendships, new connectedness, and all of those things influence how people's recovery journeys pan out.
Absolutely, and I guess they don't feel so alone. Sharing experiences through those interactions as well is really crucial. So why are power dynamics, engagement, and enhanced observation such a focus for social hubs?
That's a very good question, Victoria. And I think historically, we've always had this issue in the sector where, when it comes to things like enhanced observations and power dynamics, it's very interesting. You know, you go into a ward round, so a meeting with your multidisciplinary team and your responsible clinician, and the service user may have been demonstrating that, you know, or presenting in a specific way or mentioning that they feel like harming themselves. And then there's this dynamic where you'll get put on enhanced observations, but often it's not the responsible clinician, it's not the psychiatrist actually carrying out those enhanced observations. It's often support workers and nurses on the ground. And what that actually really looks like a lot of the time is, unfortunately, a staff member sat in a corridor on a chair watching someone in bed. And the social hub has turned that issue on its head by creating this space where people want to go there, both the staff and service user alike. Because we often speak about sensory in a way as if it only benefits service users, but equally sensory also benefits staff as well. And we've seen a lot of people who may have been on long-term enhanced observations or people who need extra support able to come to the social hub and break those power dynamics by sitting down with a staff member and having a game of FIFA on PlayStation, or, you know, listening to music together. You're both listening to the track, you're both singing along to the lyrics, or you're both playing a PlayStation game. The service user can win. The service user has the opportunity to beat the member of staff. And there's something humanizing in that by breaking down those power dynamics and moving away from this individual with these keys sat in a corridor watching you powerless and hopeless in bed. And it's a balancing of power, but also changing that dynamic of being under the watchful eye of a clinician or a staff member.
Absolutely. And so I'm sure you've gathered data to demonstrate the impact of these. What's the data shown?
So the data has been very interesting. So we've done a bit of a snapshot since social hubs have been established, and we've seen significant reductions in incidents. It links back to the last point that we were just talking about. So in one of our services, we saw more than a 50% reduction in incidents. So literally incidents slashed by half. We went down and we wanted to unpick that a little bit, because, you know, sometimes we do projects in the sector and we always say, oh, you know, it's reduced incidents just by looking at the data and from a quantitative standpoint. We went down to the ground and we wanted to understand the qualitative experience of people. What is behind this data? Why have these reductions happened? So we spoke to the staff, we spoke to managers, we spoke to service users, and a lot of people cited some of what we've been discussing today. In that site specifically that I mentioned, where we saw more than a half reduction in incidents, it's a person who actually requires 4 staff with them at all times. But actually through the social hub, they're able to come down and interact in different ways. There's been a reduction in how much support they actually require through that, according to not only staff, but the service user themselves. And that's also significantly reduced incidents, which were largely down to some of those dynamics of having lots of staff, which can be quite disturbing. And, you know, I remember the service user said something very powerful to me, in that the social hubs feel like home, and home made them feel better. And it reminded them that there is something outside of hospitals. It's almost a way to connect back to your former self, or to assist with your recovery journey. And I think that's something we really need to recognize and build on, not only just in terms of social hubs, but in terms of the built environment more generally. We need to make more homely, welcoming, sensory, considered environments, because that's what people really benefit from in terms of their health and well-being and in terms of their experience.
That must be so rewarding to being involved in a project that's impacting people in that way. What a wonderful thing to have done. So what are your plans moving forward? You're not going to stop there. What's coming in the future?
Well, we started with one social hub at Cygnet Barley, and I think in the last year we've done around 25 now. So on average, it's something like once a fortnight, and we've been doing them, and we're hoping to have one in every single one of our services by the end of the year. And I think it's achievable, and we're going to be speaking about it more at the conference. But the idea is that once we sit down and get a wish list together with service users and staff, and we order all of the bits and bobs for the social hub, we put it together in one day. So it is achievable, because the power of co-production and bringing different departments together, you can achieve so much in a day. But often in organizations, we work in silos, and there's so many different departments responsible for different things, and often that's what can cause delays. So the future really is not only having more social hubs out there, but also thinking about how can we learn from this process in terms of the wider culture change. If we've been able to do such a fantastic project by working together on social hubs, why can't we learn from that with respect to other things? And there's something in that for me that's really important. It's about culture, it's about collaboration, it's about that spirit of co-production.
Absolutely, and you know, who knows, you may have made a template to use what you're doing in other settings. So you're speaking at Design and Mental Health. Your presentation title is Cygnet Social Hubs, and you will be joined by several other people from the sector, including those with lived experience, who are going to join you and contribute to that content that you're presenting to the audience. So a huge amount of learning to be gained from that. So thank you very much for your time today. It's been a pleasure talking to you. Just to remind everybody watching that Design and Mental Health takes place on the 3rd and 4th of June in Manchester. If you'd like to engage with Raf and his colleagues and all the other speakers on the programme, you can book your conference pass at designandmentalhealth.com. Thank you so much for your time today, Raf. It's been a pleasure speaking to you, and we'll see you in Manchester in June. Thank you very much.
Thank you so much.